Okay, ready? And we'll go. Thanks for coming in today, Katrina. Really looking forward to going through this training with you. Thanks for coming to the pre-training screening so that we could find out what the aims were. So as you know, the aim of today is to cover off first aid, treating sprains and strains, including bandaging. So we've got 15 minutes. Being one-on-one, that should be absolutely fine. Do you mind if I call you Kat?
No.
We kind of fell into that when we first met, so I'll probably get into that habit of doing so today. So just a bit of housekeeping. Just want to make sure that the phone's off. Great. Do you know where the toilets are?
Yes.
Are you comfortable in that chair?
Yes.
Not too hot, not too cold?
No.
All right. Do you need a glass of water?
No.
Okay, you're all good. Excellent. Just want to make sure that you're comfortable to get the best learning outcome and make sure that you retain the information. Okay, so I wanted to draw your attention firstly to the learning materials. I wanted to make them really accessible so that you can go back and revise after today's session if you feel that you want another go through, or if I've gone too fast, or if there's something you want to recap on. So I've sent you already, you'll find in your information, this website, which is Royal Life Savings, Sprains and Strains. So Katrina, as I understand, the swim camp host at Nepean Swim and Fitness.
That's good.
A lot of that I understand from the briefing is out of the water and then in the water. So out of the water, we've had some strains and sprains. Okay, which is going to happen when kids get together and do races and relays and things.
Right. Yeah.
Okay, excellent. So I just wanted to start with what is a sprain. And as we can see on the website, a sprain is a partial or complete tearing of the ligaments and tissues at a joint. So that can be caused by falling, twisting, or getting a hit. And can you recall a situation where that's happened to any of your children at camp?
Yeah, we've been a little bit silly and they've fallen off something or... Yeah.
It's going to happen with kids, right?
That's right.
And then in comparison to that, a strain refers to the stretching or tearing of muscle or tendon fibres, which is tissue that connects the muscle to the bone. So that slight difference there. Twisting or pulling the tissues can cause a strain, which can happen suddenly or develop over time. Whereas with a sprain, because it's a partial or complete tearing, that seems to be more of happens as a result of an injury. Okay, so just want to go back over the signs, or go to the signs and the symptoms. So we've got pain at the site of the injury, which I'm sure they've come to you and said, Miss Katrina, my knee, it hurts. Loss of power in the injured area, especially with a sprained joint. Swelling of the injured area, and we're going to work on that with the bandaging. Nausea can also be a sign or symptom. So they might come to you and say, Miss Katrina, I've got a belly ache. And if they've just had a fall, that might give you some information.
That's right. Yeah.
And kids have belly aches a lot, right?
All the time.
Yeah. Feeling faint or giddy, and we can't have that around an aquatic environment.
No.
And also feeling pale, cold and clammy. If they've hurt themselves really badly, that's where shock can come into play. And you've done some first aid training around shock, I believe, in the past. So, okay, so that's great. So, any questions about that, the difference between a sprain and a strain?
No.
Okay, excellent. And again, you've got this resource, so you can always go back and just really, refer back to
That's
that
right.
if you have any questions. Okay. So, have you ever heard of the term RISA before?
I have through my first aid training.
And it's not the thing you make mashed
No,
potato
that's
with.
right.
No, okay. So, for all musculoskeletal, I find it hard to say that, musculoskeletal injuries, I need to practice that, like sprains and strains, it's really important that we have that immediate RISA treatment to minimise the long-term damage, and during that first 72 hours is vital for optimal outcomes.
That's right.
So, do you know what R stands for?
Rest.
There you go, excellent. So, ideally lie down in a comfortable position, and that minimises swelling and bleeding and further damage. And if you're not able to fully rest, you may be able to use a sling or crutches or anything that can help you to go about your daily activities but still be resting that particular... Exactly. I think you know what I stands for. Ice, that's exactly right. So if you ice the injured area for 20 minutes every 2 hours, that's fantastic. Using crushed ice. If that's all you have there, like at a barbecue or something, you might have more access to an esky or an ice pack that can be wrapped in that damp tea towel. So be really wary of people who might have circulatory issues, like older people might burn their skin.
Yes.
C, what do we
Compression.
think? Compression, there we go. Excellent. I should have hidden these answers.
I know.
No, I think sometimes when you're able to read them and put them together like this, it
Jogs
enhances,
your memory.
enhances the learning outcomes, absolutely. So compression. We're going to compress the injured area with a compression bandage to minimise the swelling. Now, if it's on too tight, you might get pins and needles.
Yes.
And if it's cutting off your circulation, we have to loosen it or take it off completely, and especially when you're sleeping, because you don't want to wake up and have, blue fingers.
That's right.
Not a good look. E,
Elevation.
absolutely. And can you take a guess as to why we elevate the injured area above your heart?
Because it stops the blood from flowing, or it makes it go slower.
Minimises,
Minimises.
exactly, which
Yep.
then reduces the bleeding. You
Bleeding,
said blood.
that's right.
And the
Swelling.
swell, exactly. No, you've got it, 100%. And then what does R, we used to just say rice, and that changed, I'd have to say in the last decade, to ricer. What do we think the R on the end might stand for?
I haven't done the R yet.
There you go, so referral.
Okay.
So whether that's when mum comes in to pick up little Johnny from swim camp and you say, look, little Johnny hurt themselves
Okay.
today, you should perhaps take them to your GP just so that you're not worried. Or obviously, if there's, an ambulance there, you're referring them to the paramedic. So that referral has been added.
Okay, that makes sense.
Excellent. So is there anything you wanted to ask about
No,
the
it's
RISA
just
process?
at the time remembering
And I think that's why acronyms are really good as well. That whole, rest, ice, you're testing me now, compression,
That's right.
elevation and referral, RISA. And I kind of was able to say that because I was picturing that acronym of RISA in my mind.
Yeah.
Okay, it's like doctors ABCD.
That's
but
right,
We're
yeah.
not doing that one today, So I just wanted to go on now to a little video to show you how we would apply a compression bandage to a strain or a sprain. Can you see that okay?
Yeah.
Still comfortable in your chair?
Lovely.
Excellent, here we go.
So if you suspect somebody's got a soft tissue injury, you want to rest it, you want to apply some comfortable support, you want to elevate it and apply a wrapped ice pack. So the comfortable support used to be known as compression, and what we want to do is apply a bandage, and we want to wrap this bandage on, and we want to do it from joint to joint.
So joint to
if,
joint is what I want you to take
you've
out of that.
damaged your arm here, I would go from here to elbow. If you've damaged your elbow, I'd go from here to here. Likewise, either side of your ankle joint, either side of your knee joint, and down far enough. So don't just bandage the knee or just bandage the elbow, because it won't give it enough support. So what you want to do is apply it firmly, but not too tightly. And you want to be wrapping it in a sort of figure of 8.
Joint
So
to
you're going
joint,
round,
figure of
you're
8 is what I always
overlapping by
think.
about half the bandage each time as you go round. So you've hurt your wrist, so I'm going from here to about the middle of your arm
Oh,
to support your
excuse me.
wrist.
Oh, sorry, Julie.
That's okay.
Sorry to interrupt you.
Actually, while you're interrupting, I've forgotten to bring the ice pack in. Would you mind grabbing it from the freezer for me, please?
Okay, sure.
It's just in the freezer there. Thank you, Robin. Sorry about that interruption.
That's fine.
Okay, so we're going to put this on here, and when I've finished wrapping this bandage, what I will then do is check your fingers and check that if I
The
squeeze your
circulation
nail
we were
bed,
talking about.
that the colour comes back quickly, which shows that I haven't put it on too tight. So I'm
Thank
going
you
to
very
wrap
much.
up like this, and then at the end, I'm going to elevate it and apply a wrapped ice pack. Okay, so you secure it either with some tape or a pin, or ideally tape, or you can tuck it in, but it will lose the pressure. It depends why you're putting the bandage on, but if it's for a sprain or a strain, you'll probably want to support it like that, and you'd probably support it yourself. You can put a sling on, but to be honest, if I was to fold Lucy's top up, that would give her a little bit of extra support. And generally, if you have got a sprain or strain, you'd be much happier holding onto it yourself.
Okay, so that just, I find visually, and I think when we first met you said that you like to learn visually, so I always find that that's a good thing before then giving you the bandage and we practice. So, Are you understanding that so far? Are you happy to try
Yeah,
that
yeah.
yourself? Okay, so we're going to do it within a scenario. So this is your little bandage pack here. You can take that away and practice, and there's all sorts of slings and things that you can practice there as well. Now, little Johnny, we're going to use him again, he's really accident prone, has come up to you during swim camp and said, Miss Katrina, I've fallen and I've hurt my arm. Okay, so we're going to go back to that ricer analogy. So R, we're going to rest it, that's right. We're going to I,
Ice it.
that's right, exactly. Now little Johnny probably doesn't have any circulation problems.
No.
So you could grab, and we don't have a tea towel here, so we're going to improvise, and I'm going to use the other bandage in your pack just to show you that you can use anything there. We're still going to make sure he doesn't get any kind of cold burn, okay? So I'm little Johnny. So my arm is hurting. Would you like to apply that to my arm? Thank you. So we've rested and we've elevated. That's great. Okay. Excellent. Now, as we've seen in the video, would you like to apply C, which is the,
Compression.
yep, if you'd like to grab the bandage. Now, what were the things that they said? Joint to joint stays
to
with
joint,
me,
that's
and
right.
figure 8 as
That's
well.
right.
So feel free to wrap me up like a mummy. Egyptian mummy, not a mummy mummy. Figure 8's beautiful. Yep, you're doing a great job. Excellent, that's it. And I'm not going to help at all because chances are little Johnny might be, but it hurts, Miss Katrina. So not being as helpful and compliant as I'm being. That's great. Now you might have to ask me about how tight that is.
Does that feel comfortable?
Yep, absolutely.
Not too tight?
No.
Can you wiggle your fingers?
I can wiggle my fingers, and are they blue?
No.
No, you've done a great job then. Excellent. And you'll find there's a little pin here for your use as well. I mean, you could
I was
tuck
just
it,
going to tuck it,
Yep.
but that's okay.
but that might, especially with a child, we'll probably keep the bandage on a little bit
That's
firmer
right.
for a little bit longer.
Wonderful.
That's great. So we've done compression. What comes next? R-I-C-E.
Elevate.
That's it. So if you get them to hold it there, and then we might call mummy. That's a good idea.
That's right.
And then we might call mum.
Yep, just to let them
And
know what's happened.
Exactly, and do the
And
referral.
what we've done.
See if she wants to come and pick up little Johnny and take him to the GP or you know, whatever the next step is. Okay.
Lovely.
So, do you feel comfortable with everything that we've learnt
Yeah, I
today?
do.
Excellent.
I do.
Fantastic. And you know where the resources are to recap this afternoon?
Yes.
Okay, excellent. So, if I can just see if you have any further questions before we wrap up, or wrap up for today.
No, it's just good to refresh. Really important because there's things that we forget, and I didn't know the last one for RISA.
Yeah, things do change.
So things do change over time, and that's really helpful.
Excellent. All right, well, thanks for coming in, and reach out to me if you need to ask any questions at any time.
Lovely,
Thanks,
you.
Katrina.
Thank you.